Dr. Mack, thank you so very much for joining me in this discussion of the SOS Council's mission and healthcare disparities. I would love for you to start by introducing who you are and the work that you do in healthcare.
My name is Dominic Mack. I'm a professor at Morehouse School of Medicine in the Department of Family Medicine, and I'm also the director of the National Center for Primary Care. I'm a family physician by trade in the healthcare arena. So what we do is develop a lot of training, education programs that touch primary care providers and primary care systems. A lot of our programs are federal programs. We do a lot of big data research, and actually what we call implementation type programs that help providers on the front line to actually provide better care to their patients. So we kind of give them the ammunition from a primary care perspective to improve their practices, but also to better approach the public. And this is mostly around health equity, all around health equity. Our mission and the Morehouse visions and missions are based on health equity and having equitable health care for all people.
Based on your provider perspective, I'd love to gain your insights on why it is urgent to address healthcare disparity in this particular time frame that we're in.
Of course, it's the COVID-19 pandemic. As far as the disparities, we've heard about the disparity in the way the virus, the morbidity and the mortality that occurs with the viruses in those ethnic minority groups, African Americans, but also other ethnic and minority groups across this nation. So the immediate concern is how do we have equitable access to care for those populations, to testing, and hopefully the vaccinations will be on board soon. But also we have pre-existing chronic diseases, and during this time, those haven't gone away. So how do we improve the care, even in times of pandemic, to not just those who are suffering from the acute health problems, but also those who have the chronic health problems, all those social determinants that affect our health. We see now that violence has increased. And with increased violence, you get injury, you get shootings. That affects the health of the community. So one of the things that are set in our model is the social determinants of health are so important when it comes to the health of communities, and they affect that, transportation, food deserts, things of that nature. So during times of pandemics, and this is, of course, not the first pandemic and not the first disaster. I mean, you want to look back to Hurricane Katrina and how diverse populations are affected diversely. It's the same way with this pandemic. If you have a population of folks, including African Americans and others, that are unequally impacted during normal times, quote unquote, when pandemics affect, the impact is multiplied. So that's what's happening now. It's around COVID, but it's also around pre-existing diseases that are not being cared for at this time.
From a public health perspective, we're now having national dialogue about healthcare inequities and healthcare disparities. But I'm curious to know what makes achieving health equity personal to you.
This community I grew up with was personal. I've seen it. I've seen it in my community. I was once a teenager, and I grew up in African American neighborhood in the South. But again, as I grew up, I've seen family members have health problems. I've had health problems and had to access the healthcare system. And then as a physician, I've seen with my patients. I've seen it from my personal patient, but I've also seen it from in other institutions and especially in the research that we do, the environmental scans that we do to see how people are accessing health. And then, of course, also how are minority and physicians and health professionals treated in the environment. So from multiple aspects, personally, um, I've seen it, and also it's inspired me to try to do things, be a part of things that can help with overcoming the disparities.
Dr. Mack, thank you so very much for taking time out of your day to have this discussion on health equity and addressing healthcare disparities. I appreciate your time and look forward to talking to you soon. Take care. Bye.